Hello, my name is Donna Boehm, and this is my final head-to-toe assessment for our health assessment class. While I'm waiting for my patient to come into the room, I'm going to go wash my hands with soap and water. All right, we've done that. We're doing that for infection control. I'm also going to use some hand sanitizer just for an extra precaution, and I have wiped down with alcohol all my equipment and my stethoscope. So now I'm going to have the nurse bring my patient in. Good morning, my name is Donna. I'm the nurse who's going to be doing your assessment.
Good morning.
And your name is?
Brenda.
All right, go ahead and sit down, Brenda. As Brenda's walking in, I'm assessing her gait. She's walking, she has an excellent gait, no limps, nothing bad. She has a good gait. She's swinging her arms exactly how she needs to be. So we've assessed that. Today we're going to do your assessment. We're going to start with vital signs, and if you don't mind, I will be writing as we go along. Are you comfortable in the room? Are you warm enough, cold
Yes.
enough? All right. Let me know when you're not, and let me know if we have anything that's painful or you're uncomfortable with. All right? We're going to start with your vital signs and your blood pressure. Right. 118/76. That's excellent. I'm going to be listening to your heart rate, and as I'm doing that, I'm going to be listening and checking your respirations. We would be doing this for a full minute, but unfortunately they've taken my clock out of this room, so we'll simulate that. Excellent. Heart rate 68, respirations are 16. And as we were doing that, we were looking to make sure she had even rise and fall in her chest, everything symmetrical, and it was. Any respiratory distress are you having? No. I'm not seeing any kind of distress, any gross deformities or anything like that. So I'm going to write your vital signs down real fast, and then we'll get started. All right. And as I've been looking too, I noticed that she has nice tan skin. Nice and even, no lesions, no wounds, anything like that. It's soft, it's moist. She has excellent skin turgor. And we're going to check her capillary refills, both of her hands. She's got nice pink nail beds and less than 3 seconds on that, so that's good. Her temperature is warm, and that's good too. Her muscle mass is even on both arms. I don't see any masses, any deformities, or any edema in her wrist, her arms, or anything like that. I'm going to check her radial pulses, while I'm here. I'm going to check them one at a time. Then I'm going to check both of them. Excellent. All right. And tell me your full name.
Brenda Lynn Hartzell,
And your birth date.
9/14/70.
And tell me again your situation and why you're here.
Just for a general checkup for a new job.
And today's date.
10/9/2015.
And where are you at?
North Arkansas Regional Medical Center.
Excellent. We are going to check some of her cranial nerves and to make sure everything's okay. I'm also looking at her face to make sure it's symmetrical. Her eyes are even. Her smile is even.
You can't go.
I got it. Can we cut that out?
Just go.
Okay. And I also know that her ears are symmetrical too. No problems whatsoever. I don't even see any sores or lesions, anything like that. I'm also going to just check for trachea, make sure it's midline right here as I'm doing that, and it is. I would like to check your nerves now, and what I want you to do, I want you to smile for me. Good. I want you to raise your eyebrows. Excellent. I want you to open your mouth, and I'm going to try to lift it up and keep it like that. I'm also going to check your gag reflex, and when you open your mouth, I'm going to check all your teeth, your mucous membranes, and everything like that. I have a tongue depressor that I'll stick in there, and I just want to look around in there. Nice moist tongue, nice and pink in there. I don't see any stores. Lift your tongue up, please, so I can see underneath there. Excellent. She has all her teeth in there in good condition. I also want to look at her tonsils.
I don't have tonsils.
She doesn't have tonsils, so we won't be able to look at those. So we are going to check her gag reflex. Open your mouth. Excellent. All right. As you go, I want you to say, go, go for me. We noticed as we're doing this that she's not having any drainage from her eyes, her eyelids. Externally, everything looks really good. Have you been having any drainage, exudate, anything like that? Good. We also noticed that her lips are moist. We do not have a visual eye chart, and so we would be doing that if we had it. And I could not find a newspaper this morning, so I do have a piece of paper for her to read.
With the patient sitting up, uncovered, observe for lesions, chest symmetry.
Excellent. All right, and one other thing we forgot is, can you stick your tongue out for me? And then you can do cheek to cheek inside your mouth. Excellent. All right. I'm going to go ahead and check for your eyes right now to check your pupils, and we're going to turn the light out just so we can get good visual. Look up here at my nose. Excellent. Good. Her pupils are equal and reactive to light. Thank you, ma'am. So I'm going to do her visual test. I want you to look at my finger and follow it everywhere I go. Excellent. All right. Do you wear glasses?
Occasionally.
Okay, excellent. And so I'm going to look at my paper here for just a second. I've already noticed that her ears are symmetrical, and we've done the nerves. While we're here on this side, I'm going to check her carotid, just one at a time. I'm also going to have her turn her head 45 degrees this way and look for jugular distension, which I see none, and look back the other way. All right, excellent. Okay. I'm going to go ahead and listen to her. I'm going to listen to her heart sounds and her lung sounds first before I start palpating and percussing. Just breathe normally. I'm going to listen for one more breath. Excellent. Listen to the lateral side. Her chest is rising and falling. Her respirations, there's no distress with that. I'm going to percuss. Well, first I'm going to percuss. And I'm going to feel for any masses or crepitus. I don't feel anything. Very good. All right. Okay. I'm going to come around to the side, and I'm going to go around to the back. I want her to raise her arms up so I can just make sure that I am even and everything is good from the side, and we'll go around to the back. I'm going to put your arms down. There you go. I'm also going to listen to her back. Oscillate her lung sounds. Are you a smoker?
No.
I'm going to palpate for any crepitus or masses, and I don't feel anything. And I'm also going to percuss, which I'm not very good at. All right, we're also going to look at her thoracic symmetry, and I'm going to check and make sure it's even. I want her to take a big, deep breath so I can make sure everything's even. Excellent. All right. I'm going to come around to the other side. We're going to listen to her heart, and we're going to listen to the aortic sounds here. Pulmonic. I'm going to listen to and the Irby's points right here. And the mitral. Excellent. I also want to listen to her carotid to see if I hear any worries. I need you to hold your breath while we're doing this, please. Excellent. All right. So go ahead and have you lay down. I'm going to check for your distal pulses. We're going to check your brachial, or your radial, I'm sorry. We're going to check her popliteal. We're going to check her dorsalis pedis. I'm going to take her socks off, and as we're checking her skin here, we're looking on her legs to see if we have symmetrical muscles, any deformities. We do not. We have good pulses. She has no swelling in her ankles and swelling in her legs as I feel them. And while I'm down here, I'm just going to go ahead and check clonus here. I'm going to lift her knee. I'm going to move her foot up and down just a little bit. Excellent. I'm going to do it again on this. Good. All right, can you put your head down just a little bit, and I'm going to check her abdomen. I'm going to write here for just a second and look at my sheet. All right. Are you comfortable? Do you want me to cover your legs with the sheet here just a little bit? We're going to look at her abdomen and just assess it. We're going to look for the contour. We're going to look for any pulsations anywhere, any unevenness, possibly hernias or anything like that. I don't see anything at all. I want to listen. I'm going to start in the right lower quadrant. I'm going to percuss. And I'm going to do light palpation. Let me know if I touch anything tender or you're having any problems as I'm going. I'm looking at her face and seeing if she's grimacing. And we're going to do a little deeper palpation. We're going to check and see where the liver is. It's right, the notch is right where it should be. And our findings are good on that. Excellent. All right. And now I am going to check her reflexes, and I would like for you to sit at the end of the bed, and I have my trusty little hammer here. And we're going to reflexes, and we're going to do and I'm going to range of motion. She has excellent knee range of motion. And I'll have her lay back down again because I forgot the hip range of motion, and we'll go ahead and do that as we're doing it. I'm going to put my hand here to feel any clicks or pops or anything going on there, and check her face if she's grimacing. She probably would if I stuck her head above her foot above her head, but right now she's doing okay. And I need to check your strength. I need you to push down on my hands. Excellent, excellent. Then I need you to pull up. Good, good, good. All right, let's sit up, and I'll have you do the same thing with your hands. I need you, yes. And I'm going to put my hands on top of yours, and I don't want you to let me push you down. Excellent. All right, and the same thing. Good job. Excellent. All right, I believe that is the end of our evaluation, and thank you very much.